Yasher Koyach. Yasher Koyach for joining us. We are going to continue the discussion from last week. We are going to continue our talk about IVF and the halachic considerations. So let us pull up just a few items that have to be considered when dealing with an IVF cycle, any given IVF cycle. So number one, we have Puruvu. I'm going to list them by topic, and then Be'ezras Hashem will go through it one by one and see what we could do. Puruvu or Yuchsin, those are really, one could argue whether they're two sides of the same coin or two totally different cheshbonis, but a fundamental question whether the child conceived and born through an IVF cycle, which is totally not what we'd call bia kederach kol haaretz, where the couple is not together normally. It is the sperm is extracted and deposited, and the eggs are harvested and fertilized in the lab, and then subsequently implanted into the woman. That is not the normal derech tashmish. That's not the normal way children are born, and therefore one could seriously argue that perhaps the children are not going to allow the father to be makayim the mitzvah of puruvu, and furthermore, the child may not even be misyaches to the father. If the father is a Kohen and the child is born via IVF, it is questionable whether the child is a Kohen like the father, and that could present many issues in shul, embarrassing the bar mitzvah bacher who gets an aliyah for the first time. Everybody knows the father is a Kohen, and here this child is getting shlishi, is getting shishi. It could be very, very embarrassing. Kahuna. Number one, the question that we just spoke about, whether there's kahuna, but that's really yuchsin. Another fascinating dimension to this, maybe a kula, is the halacha that a kohen is not allowed to marry a chumrah, although I'll share with you a chumrah of Rav Shechter. A kohen is not allowed to marry a woman whose father is a guy, right? The halacha is that the Gemara discusses a case of an Eved or a Goy or an Eved Shabal Bas Yisrael and has a child. So the mother is Jewish, therefore the child is Jewish, but the father is a Goy. So the halacha is, it's an Ibayid L'Yivshit in the Gemara, but we paskin, Shulchan Aruch paskins that this child is not allowed to marry a Kohen. A Kohen is not allowed to marry a woman whose father is a Goy. We're familiar with this halacha, yes?
Coming out, so just bring
to marry a woman whose father is a Goy. Rav Shechter.
Right. If I remember though, but the Eved, can they stay married if it happens?
Since it's a shayla, since the Gemara since there's no conclusive psak in the Gemara, it's an ibayid l'yivshita. So then there's a machlokes harishonim whether or not if it was done, whether the couple has to get divorced. So there's a machlokes the Rambam and the machlokes between the Machaber and the Ramah. So it could be very well that if they get married, we wouldn't make them get divorced. But certainly on the lechatchila level, they're not allowed to get married. So I'll share with you a fascinating shaila.
Hello.
A fascinating shaila that actually came our way. There was what was it? It was two. Let me phrase it. Let me begin with this. Rav Shechter has a chumrah where he understands.
Is everything ready from Brickman?
Brickman?
Yes. Should be lorazepam and dilantin possibly.
Okay.
Sorry about that. Rav Shechter understands that the reason why a woman is not allowed to marry a Kohen is not allowed to marry a woman whose father is a guy, is because there's a special halach when it comes to kahuna, that a Kohen has to marry a miyucheses. A Kohen has to marry someone who's miyucheses to Klal Yisrael. She has to have yichus. So he bases this off of a Ravid in Yevamis. So the chisaron of a Kohen marrying a girl whose father is a guy, the chisaron is that this woman is not a miyucheses, and since she's not miyucheses, therefore there's a pagam, there's a psul kahuna. Shechter who, if you'll notice, we have this discussion whether the Vlad is Mesiaches to the father in the case of IVF, IUI, whether the child is actually Mesiaches to the father. Rav Shechter questions this in a very, very serious way. And therefore, he even questions whether a Kohen is allowed to marry a woman who was born from IVF or IUI. Why? Because again, the whole reason why a woman is not allowed to, why a Kohen is not allowed to marry an Isha whose father is a Goy, the psul is not simply because the father is a Goy, but the idea, the deeper idea is that that since the father is a Goy, she is not a miyucheses. And since she is not miyucheses, a Kohen needs to marry a miyucheses. So too, if a child is not miyuchas to if a child is not miyuchas to the parent, to the father, so since she's not miyucheses, perhaps she too would be asur l'kohen. I had a shaila of a guy calls me up, and he's dating a girl. He's in his 30s. He's dating a girl. The girl was born from insemination, IUI. She was born from artificial insemination. In fact, her mother is her partner is a woman, so he's two mothers. She doesn't have a father. She's a product of a lesbian couple who used an insemination, used a donor in order to get pregnant. And this guy who called me up is a kohen, and he wanted to know what Rav Shechter, he specifically asked for Rav Shechter's opinion. He specifically wanted to know what Rav Shechter would hold. Is it permissible for him to get involved with this shidduch and get married to this girl who was born through insemination? And I spoke to Rav Shechter on the phone, and Rav Shechter said no. Rav Shechter said it's really better that they shouldn't get married. Okay, long story short, it wasn't so simple. They were a little bit older. She was older. He was older. In the end of the day, there was pushback, and some other Rabbanim got involved. And Rav Shechter said, if they're really of age, they're in their upper 30s, and they're still single, so okay, one can rely on the Mekilim, but certainly on a lechatchila level, Rav Shechter was very hesitant to allow this Kohen to get married to a woman who was born from artificial insemination. Why? Because of the psul of her not being a miyucheses. Very interesting. So something to think about how this plays out, how the din of kahuna plays out. Pikuach hilchati, this is halachic supervision.
I'm sorry, Rabbi. I'm sorry.
Yes.
And the donor's sperm was from a non-Jew?
It happened to have been in that case that the sperm was from a Jew. That the sperm was from a Jew. Nevertheless, according to Rav Shechter, since the child was conceived without, normal intercourse, but the child was conceived through insemination, so regardless of whether the sperm was from a Jew or from a non-Jew, the fact that there was no bia, there was no actual bia, so therefore there lies the chisaron and the lack of a yichus to be created, because the yichus is created through bia and not through sperm entering the body in in some type of scientific fashion.
Wow. And even if the anonymity would be taken away, if the
right, correct. It happened to be they knew the donor. This lesbian couple actually knew the donor. They approached him, and he agreed to help them out.
The only problem of yichus is to the father. Why is it yichus to the mother?
Well, the yichus to the mother means she gives birth to the baby, so the baby actually comes out of her. So it's her egg, it's her womb. The yichus is there from the mother.
The egg was in the pot. The egg was created. Oh, but by IVF, the egg is in the pot. It's created in the pot.
And so they're correct. I mean, there's two different discussions.
So why is the yichus to the mother either?
Well, no. So that Rav Shechter actually does question that. Maybe they're not miyuchas at all. Maybe they don't have any. Maybe they're not even Jewish. And Rav Shechter does entertain all those possibilities. It's easier to say, well, also it depends. Are we talking about IUI or IVF? IUI, when there's an insemination, so the sperm is going directly into the woman. She's conceiving and then giving birth. With IVF, where the eggs are taken out of the body and then being fertilized and put back in. So if you learn that giving birth creates the yichus for the mother at least, so then the mother will be a miyuches. She'll be miyuches to the mother. The child will be miyuches to the mother because the mother actually gave birth to the baby. It's similar to what the Gemara says that we know who a mother is, but we don't know who a father is, right? Because we know who the mother is. We can have edus that a mother gives birth to a baby. We can never have edus that a father is a father because maybe she slept with someone else and it was Yenam's zera that she conceived with. So that's why the Gemara comes on to a chazaka or roiv be'ilos acharabal. So we know that a person's father is the father because of roiv be'ilos acharabal, right? But a woman, you don't need to come on to that roiv be'ilos acharabal svara because we see einayim rose. We see the baby comes out of her. So since the baby comes out of her, she's the mother. And the whole question in the Gemara is who's the father? Parenthetically, we know that a father is a father because of Rav Be'ila Sachar Habal, right? Which assumes that there's a Be'ila. What happens if the father is a father not because of a Be'ila, not because of a Maisa of Bia, but rather because of an act of insemination? Are we able to utilize the same svara, the same Rav Be'ila Sachar Habal, the same Chazaka, the same Rov, allowing us to determine that a father is definitely a father, like all of the dinim of fatherhood? Are we able to use and utilize that chazaka even when we lack the very basic form of bia, which initially was the underpinnings of Rav Be'ilai Sachar Habal? Something to think about.
So, arguably, if a man produces sperm and brings it, and there's hashgacha of him bringing it to the bank, and it's supervised, Pua supervises the transfer to the sperm bank, to the doctor. And then there's hashgacha in the transfer back to the mother when they were into the IVF, when they're doing they're fertilizing the egg. And then there's hashgacha when they bring it. That's better than rove.
Correct. In terms of knowing, definitely that the same zera that was initially ejaculated, it was the one that entered the woman. That's true. But if that's true. So you're arguing you don't even need a chazaka. You don't even need a chazaka of Rov Be'ila Sachar Habal if we know bevadai. I guess the idea is that okay, so let's say you don't have that. Let's say you don't have that hashkacha. Are you even allowed to rely on the chazaka that the Gemara had presented of Rov Be'ila Sachar Habal?
And then you have to worry about Rav Shechter's concern, and he's saying there's no yichus anyway. And then you have to raise a question. Again, is there a need for geiros because it's a guy? And let's say it's a donor egg also, for example.
Correct.
So because the mother is, even if it's a donor egg, you could argue the mother still carried the baby and birthed the baby.
Correct.
And the
We're gonna
father
have a whole shiur on donor eggs and surrogacy. There's so much to talk about. That itself. There's so much to talk about.
I'm sorry, talking too much. I don't mean to interrupt you. I'm sorry.
No, please, Adirabba.
Halacha will not accept DNA.
Generally not. That's a good question. We'll have another share about that later when we discuss genetics more be'iyun. So we generally don't accept DNA, although it really depends on what the shaila is. In other words, sometimes in order to the poskim have discussed to identify people who have died, to allow their wives to be married, that their wives shouldn't be in aguna, whether it's the 9/11 case, that's really where it became very famous, where there were missing bodies, there were missing people. I don't think, in recent tragedies, I don't think that there are, at least in Florida and whatnot, or Meron, I know that was like when those tragedies occurred and there were missing bodies, there were missing people. I think in the end, people were identified. So they didn't need to come onto DNA. But cases like a 9/11, where there were bodies that were still not identified, the question was, do their wives have a din of an aguna, or are we able to find some little piece of DNA in order to assume that they in fact can be considered dead and allow for the woman to be not an aguna. Now, I'll just give you an amazing case. I mean, hold on just one second. Just one second over here. There was an amazing case of a man who did a DNA test. He did a DNA test and he found out that his father was not actually his father in DNA. Biologically, his father was not his father. Then they did the further testing and they were able to trace the father to the man next door, the next door neighbor. So not only, and mind you, this guy who did the DNA test initially was a Kohen. So overnight, he went from a Kohen, kosher, to potentially a non-Kohen mamzer, right? Because if his father, his biological father, is really the guy next door, right? Who is A, not a Kohen, and B, was the one who slept with his mother while they were still married. So that would make this guy a mamzer and no longer a Kohen. The question is, are we allowed to look at the DNA? Are we allowed to look at the DNA and come up with that conclusion and really ruin his life? So DNA really has to be considered because there's a tremendous amount of shilas that come up when we start to consider DNA. But we're going to discuss that at length in the shir, which is more geared towards genetics. But I do want to speak about pikuach hilchati. I do want to speak about supervision a little bit because there have been a number of cases. Most famous, the ones that hit the news in the past 2 years are actually both from LA. The most recent case, which is just a few months ago, was with an Israeli doctor that I work with all the time. And there was a mix-up. There was a mix-up of genetic material. Definitely something that has to be considered using supervision when going ahead with treatment. Hotzar Zel Batala is another shaila, a severe shaila that has to be addressed whenever going through any IVF cycle or IUI cycle, or even just an analysis, a semen analysis, doing treatment before mikvah on Shabbos, which we'll have a whole shir about, whether it will make you a nida, whether there's a problem of ben nida, whether the bris milah can take place on Shabbos if the baby is born from IUI or IVF, which I think Rabbi Krom discussed in a previous year, whether or not this type of treatment should be available to single women who want to avail themselves of motherhood. They want to become a mother. They haven't been successful in finding a partner. What is the attitude, halacha's attitude towards single motherhood? And there's so many more shilas that come up as days go on, as the years go on, as the technology becomes more advanced. So just tons of shilas that keep the poskim very busy. These are all, definitely shilas that come our way. And it's something that Rabbanim should be familiar with as they are being consulted with from their balabatim. So let's just go ahead with a few of the shilas. Any questions before we go into the details? All right. Now, when we talk about pruruvu, when we talk about yichos, we'll try to knock this out on the quicker side because we have a lot to talk about and not so much time. And I also think that a lot of this stuff was covered in Rabbi Lewis's presentation. So I do apologize if I am repeating anything, but it's always important to know. And this is one of the most fundamental gemaras that we can apply to modern day technology, modern day fertility treatment. And that is the Gemara of Chagiga Dalid Amud Beis, where the Gemara says, what is the status of an Isha Besula She'ibra? We know that a Kohen Gadol is not allowed to marry, is only allowed to marry a Besula. So what happens if the Besula got pregnant? So the Gemara says, how is it possible that a Besula gets pregnant? How is it Shayach, right? What's even the Shayla B'chlal? So the Gemara says, are we referencing Shmuel's din or Shmuel's ability to be Baki B'Hatoya, like the Gemara says, that Shmuel was able to be Boel, Kama Be'ilos without compromising the Besulim? Is that what we're talking about? And therefore, the Isha really did have relations. She's not actually a Besula, but the Besulim was intact because of Shmuel's tactics. The Gemara says, no, we're not Chayshinan to the Shmuel. Amar Lehu, Shmuel L'Shchiach, V'Chayshinan Shema Ba'ambati Ibra. So the Gemara says, what's the case? What's the Metzias of a woman that becomes pregnant as a Besula? Isha Shenis Abra Ba'ambati. The woman who went into the bath, and before she went into the bath, there was a man, and the man was motzi zera. So the zera was in the bath. She subsequently went into the bath, and the zera entered her body. Just being in the water, it entered the body. So the Gemara has a kasha. The Gemara assumes that the only type of shikva zera that could accomplish a pregnancy is the one that's Yorik Echetz. So the Gemara says, Meikaranam Yorik Echetz. So when it came out initially, it was Yorik Echetz, so it has the potential to fertilize. Subsequently, the Isha went into the bath and she became pregnant. So that's the woman who became an Isabra Ba'ambati. She's a Basula, Shenis Abra. That was the Gemara's Shaila, is she Muteres L'Kohen? And now we have to discuss such a woman that gets pregnant with Isabra Ba'ambati is the Motzi Hazera Makayim Puruvu. This is a question that was brought up in Beis Shmuel. He quotes in the very, very beginning of Even HaEzer and Shulchan Aruch. So the Beis Shmuel actually quotes the subject from the Chelkas Mechaykek, whether an Isha shenis Abra Bambati is that woman Makayim Puruvu or not. Im Nikra B'nai L'chol Davar, and he brings a raya. The Beis Shmuel brings a raya from the Smak and the Bach and Yeridea and Hilchos Nida, where the Shulchan Aruch talks about the harchakos of nida and Siman Kuf Tzadik Hey. So there the Shulchan Aruch is discussing harchakos, whether you're allowed to be on each other's bed, not. So the Taz over there says, he quotes the Smak and Rabbeinu Peretz that being musar shal tishkav al sadin sheshachav alein ish acher. So he brings that a person should be careful not to sleep on the sheets that another man slept. Why? Why should a woman be zahir not to sleep on the sheets that another man slept in? Pen, what's the issue? Pen tis aber mishich vazer shalacher, because maybe she'll get pregnant from the shich vazer shalacher. Shema yisa achoisa me'aviv. And there, what's going to happen? She's going to get pregnant, and she's going to think really it's her child and her husband's right child, but really the child's father is the initial motzi zera, the person that slept in those sheets. And maybe her child, or this child, who was really Messiachis after the Motzi Zera and the sheets, is going to end up marrying a sibling of his or hers, because they don't really know the father. They didn't know that they were siblings to begin with. And therefore, there's a concern. Therefore, la halacha, stay away from that situation. Don't go in those sheets. Says the Beis Shmuel, there was no bia there. There was no actual, there was no formal intimacy b'chlal. So why should we be choshesh that the father is actually going to be the Messiaches, he's actually going to be considered the father? Says the Beis Yosef, says the Beis Shmuel, nishma dehave b'no l'chol davar. The fact that she got pregnant with Yanim Zera means that Yanim is the father. And we have to be choshesh for it. And therefore, so since he's the b'noi l'chol davar, he's the father, he's the son, mashma, that there's yichus, and assuming that there's yichus, it should be that the father's Makayim Puruvu. Right? It's his child. So why wouldn't he not be Makayim Puruvu? So la halacha, there is a machlokes haposkim. The majority of the poskim seem to go with the assumption that the father is Makayim Puruvu in the case of Nisabra Bambati. In the case of Nisabra Bambati, that the father is Makayim Puruvu, just like the Beis Shmuel, just like the Taz. L'chayra, that would be the majority of the poskim. However, it's important to note on the right-hand side, there's a list of 3 poskim. We'll start with the first 2, the Shelas Yaivitz, who was actually talking about insemination. The Yaivitz was actually discussing a case of IUI, of Hazra'ah Malachutid, of talking about a case of insemination. Even hundreds of years ago, they had this technology. Well, it's not so difficult. It's just shooting up the zera. But he writes that the child would not be Messiachis after, if the father would not be Makayim Puruvu. And Rav Shechter has quoted this Yaivitz in kind of a conversation that I've, numbers of conversations that I've had with him. He's quoted this Yaivitz to seriously question whether or not the father would be Makayim Puruvu and whether the child would be Messiachis after the father. Chelkas Yaakov also has a similar take. And the Tshuvas Van Hagos, Reb Sternbach, in his earlier tshuvas, also questions whether the child would be Messiachis after the father, questions whether the father would be Makayim Puruvu. Reb Sternbach is very suspect. He doesn't think so in earlier tshuvas, but we'll get to later tshuvas because there's a fascinating evolution, a fascinating transition that took place over the years. On the left-hand side in the green, you'll see Har Tzvi, which I'll bring in the next slide. Mitzvah Shem writes that for sure the father's Makayim Puruvu. Rav Bosner writes, for sure the father's Makayim Puruvu. Rav Avadia, Rav Moshe writes this clearly in a tshuva, as does Reb Sternbuch in later tshuvas, not in the early ones, but in later tshuvas. You'll see here in Har Tzvi, in Siman Daled, so here he writes that the father is Mekayim Puruvu. He writes that there's Yichus, and he says, even Aval B'Hazra Malachutit, he says, Kev de Motzi Zer L'Shem Kach. The father, the husband, initially was Motzi Zer L'Shem Kach, that it should be a baby, that it should turn into a baby. And then he has a svara here, an additional svara. He says, V'gam Masha Harofe Osa Hazrika, the fact that the doctor was charged and hired to do the zrika, to do the actual insemination. So maybe we can apply the din of shlichus, and the roife, the doctor is working as a yad of the father. So therefore, he says there's no shaila. The Rav Tzvi Pesach Frank writes that the child's misyaches, the father's mekayim puruvu. Maybe it would be a good chomer to find a Jewish doctor, so that way you won't have any shilas of shlichus by a guy, shlichus by Yisrael. You should have a full shlichus. You'll have all your bases covered, and the Har Tzvi writes the father's makayim. Now, if you look, it's fascinating. I could send a number of tshuvas that Rav Sternbuch writes about this. Sternbuch writes many tshuvas about IUI and IVF. Happens to be there's a chashuv, a member of our kehila here in Los Angeles. His name is, maybe you've heard of him, his name is Tzvika Reisman. And Tzvika Reisman has a number of svarim called Ratzka Tzvi, and he became very involved in fertility. I'm not sure what exactly happened, but years ago he became very involved in fertility. He liked learning about the sugyas, he liked giving shir on the sugyas, and he also has a very dear friendship with Reb Sternbuch. So I think it's due to Tzvika, who really chewed Reb Sternbuch's ear off about fertility treatment. Very often the tshuvas done about fertility are addressed to Tzvika. Whether he writes it explicitly in the tshuva or not, Tzvika has all the letters. And many of the tshuvas that Reb Sternbuch writes about fertility are all to Tzvika. And in the initial tshuvas that Reb Sternbuch wrote to Tzvika, so he was very against it. He was very against fertility treatment, allowing it, and part of the reason is he thinks it's weird, it's not normal, it's not something which is acceptable, it's not something that is done, and therefore we have to really seriously question whether or not the child can be misyaches. Certainly the father won't be makayim puruvu. B'chlal, the whole thing is aser. Shilos of shikma zera. Rav Sternbuch really didn't want to get involved, and certainly wasn't matir, and certainly questioned whether the child would actually have the status of a child, whether the father would be Mekayim Puruvu. However, in more recent tshuvas, let's say if you look on the left-hand side, he writes, over here, I'm not near lineas daiti de mistaber shekevon shatayr lo ksiv sherakim holid al yidei nikra aviv imkem kol atam lomar she'eno aviv gamor and ela and kain holid al yidei bia. So maybe the fact that the father should only be the father because of bia. He says, but really the deeper understanding behind that is because obviously that's what the Torah is going to say, because that was the normal way of having a child. The normal way of having a child is through bia. So therefore you need bia in order to have a child. You need bia in order to be a father. But he says, od gorem. Fine. However, now it's fascinating to see the progression in the development of tshuvas over the years. But he writes, thousands of people. There are thousands of people that were unable to conceive naturally. So then they started to do this artificial reproductive technology in labs, and that is the derech. Since there's so many people that need this in order to actually conceive, this is the derech. You need some type of help, some type of scientific intervention in order to help. So we finally came to this recognition that this is the derech of having children for these couples is through IUI and IVF, and therefore he says that that could be considered the father. In a later tshuva, he even writes it's karav to a mitzvah and a chiyuv gomer to do it, because that becomes the basic ishtadlus. That becomes the basic ishtadlus of having children. The truth is, I think there's a tshuva in Rav Asher Weiss's sefer where he also writes this, that maybe this is b'chlal the basic ishtadlus, and perhaps a person would have to seriously consider doing IVF if that's the only way for them to have children. This halacha comes up in another area where Rav Sternbach was asked about the bris milah. We know we've discussed this in the past, whether a child who's born from IVF is allowed to have a bris milah on Shabbos, is the milah docha Shabbos. So in earlier tshuvas, Rav Sternbach wrote no, because it's based on that Rabbeinu Chananel and Moed Katan and Chagiga rather. So that Rabbeinu Chananel who wrote that a woman we're only docha the milah if the woman conceives in a normal fashion, but if it's derech nisim, so it would not be docha Shabbos because she's not metame tumas leida, and the only bris milah which is docha Shabbos is an isha that becomes tamei tumas leida. So he wrote in earlier tshuvas that therefore, if a baby is born through IVF, the bris milah is not docha Shabbos. But then Rav Sternbach in later tshuvas says, but nowadays that I hold that it's taka normal and the father's taka makayim pruvu, and it's b'chlal basic kishtadlus. So he says this then also changes, and therefore the bris milah taka would be docha Shabbos because this is the normal way of getting pregnant. Beautiful letter that Rav Vosner wrote. You'll see here, it's very clear. He says, "Hareini b'zel legalos datenu das Torah," and others signed off on this as well. I think Rabbi Yoshev, signed off on it. He writes, "She'elu shelo zachu li'pakid b'zereh shel kayama b'derech haragil." People who weren't able to conceive naturally, so whether it's IUI or IVF, okay. Who is done with hashgacha, says Rav Vosner Zatzal, al piatora yichos hayeladim anal lohireim k'bnoi ubita l'chol davar. These children are bnoi ubita l'chol davar. Umekayim b'zeh mitzvahs piri v'rivya. The fathers are makayim pruvu. V'chein mal moisam b'yom hashmini b'yom hashabbos. K'mosh kasavti b'shevet Levi. And certainly a person cannot be moitzilaz and question their authenticity, question the legitimacy of these children. The anu tefillah HaKadosh Baruch Hu yivkod es kol manu b'dvar Yeshua v'rachim v'negula kreva amen. It's a pretty explicit letter which is found in Chaveres Teretz HaMishpacha. You can look it up yourself. Gillian Beis Amud Ches. Clear indication from Rav Vosner and other Gedolei HaTorah that the children are considered miyuchasim, the fathers are makayim pruvu, and the children are mild on Shabbos, which is again being a function of a normal, normal conception. If you look in Tzitz Eliezer, okay, this is in Tesvav Memhei. Tzitz Eliezer never had a very positive outlook on IVF. Avalamito shel davar nira la'acharayun ki kiyum merchak rav beineim. Midin hafraya malachutit hu harbe chamor midin hazra malachutit at shalonitan klal ashvosum hadadi. So therefore, it's important to know that even if we're going to talk about fertility treatment in general, the Tzitz Eliezer, Rav Oldenburg was always very careful, and he wasn't so thrilled about anything. But certainly, it's important to know that there might be a distinction between IUI and IVF. That when the zera is being inseminated, it could be that there's more of a derech of a normal conception. The conception the fertilization is happening inside the body. Maybe it's easier to come on to a maskana that the father there is makayim puravu. Rav Vosner in the previous letter was not machalik. He said explicitly both. He said, if you look here, he says hazrakat zera o hafraya chutz gufanit. That refers to both. That refers to both IUI and IVF, but the Tzitz Eliezer of Oldenburg is questions that. So it is important to know that not all poskim agree to this. The majority of poskim agree that the father is Makayim and the Vlad is Misyaches. But there are poskim who question it, and there are poskim who question the difference between IUI and IVF. Perhaps with IUI, yes. Maybe with IVF, no. it's important to keep that in mind. I was last 2 years ago, I gave a course to the YU Kolel Elyon about fertility treatment, about fertility PUA course to the Kolel Elyon and YU. And before I taught the course, they wanted me to meet with various Rosh Yeshiva to come up with a presentation of the YU approach, the specific, the opinions of Rav Shechter, Rav Willig, and Rabbi Neuberger, and met with Rabbi Sobolovsky also. So I remember Rav Shechter telling me that really he really questions whether the Vlad is Mesiaches, and whether the father will be considered the father, and whether the father is Makayim Puruvu. And then right after that meeting, I had a meeting with Rabbi Willig, and I told Rabbi Willig that I just came from this meeting with Rav Shechter, and Rabbi Willig said Rav Shechter is an Adam Gadol. He is an absolute Adam Gadol, but we do not paskin like this. So he said Rav Shechter has his shitas, and he's entitled. He's more of a Talmid Chacham than I am, he said. But he said in terms of the Psak Halacha, he feels that we can tell people, like we saw in the tshuva from the letter from Rav Vosner, that in fact, if parents are Makayim Puruvu, the father's Makayim Puruvu, the child is Mesiachas to the father, and you can mal on Shabbos, again, not necessarily the Shita of Rav Shechter, but the Shita of Rov Poskim. Any questions on this topic before we go on to the next? Okay.
Yeah, Rabbi, if I may, just real
Yes.
quickly, and would he go so far as Rav Rosner go so far as to say that he'd be a Kohen too? The yichus is so complete.
Yeah. And the child would be born. The child born from a father who's a Kohen would be a Kohen. Rav Shechter quotes from Rav Shlomo Zalman. The Rav Shlomo Zalman apparently questioned that. But other poskim do not question it. It's explicit in Rav Moshe that the child is a Kohen 100%. It's explicit in Rav Moshe that the father is Makayim Puruvu, the Vlad is Mesiaches, nothing to talk about. Okay. In terms of sperm procurement, which is relevant to almost all treatments, whether it's an IUI, whether it's an IUF, we're going to need to be IVF, we're going to need to be Motzi Zera. In addition, there's also a question about a semen analysis, not just for the sperm being used for a specific purpose, other like a treatment, but even to test the zera, to see what the quality of the zera is. So whenever we have the shaila of how to procure a sample, so it's important to know that there are different shitas. There's different shitas. We have, let's say on the right-hand side, we have Rav Moshe Feinstein, which is the most extreme. Rav Moshe Feinstein, the most extreme, and again, I'm going quickly because I think we've discussed this in Shurim about semen analysis, and perhaps last 2 weeks ago with Rabbi Lewis. But Rav Moshe holds, Rav Moshe understands that there's two considerations when it comes to procuring a sperm sample. Consideration number one is this called levatala or not? Is this called levatala or not? We know that shechva zara levatala is a problem. So one could easily come to the conclusion that this is not levatala. Levatala is when I'm spilling for pleasure. Al eitzim vavonim. It's not going to have any purpose. But here it's not levatala. This is for the sake of having a child. So for the sake of having a child, this is not called levatala, and therefore it's not a problem. However, Rav Moshe has an issue with the actual method of procurement. Since according to Rav Moshe, the Gemara in Nida Daf Yud Gimel says that Loisinov learns from a pasuk of Loisinov, and the Gemara darshans that there can't be a hotzah zera b'yad v'regel. Rav Moshe learned that was an Isser D'Oraisa, and since it was an Isser D'Oraisa in procuring the sample through penile stimulation, so therefore it's very nice that it's not levatala, but there's an Isser D'Oraisa to be motzi zera b'yadayim. Masturbation is an Isser D'Oraisa. So according to Rav Moshe, you need to satisfy both. A, the zera can't be levatala, which is not an issue because we're doing it for an analysis, we're doing it for an IUI, we're doing it for an IVF. So you don't have to worry about that. But according to Rav Moshe, you definitely have to worry about procuring it through using one's hand. That would be usher, and it would not be justified just because of Puruvu. Puruvu is not enough of a justification to violate an Isser D'Oraisa according to Rav Moshe. Therefore, according to Rav Moshe, when if a person needs to procure a sample, they should either use a medical condom, a condom that doesn't have any spermicide on it. Most condoms that you buy in the pharmacy or at the gas station or something, wherever they sell condoms, those have spermicide on them. So you have to be very careful. Anytime if a couple calls the Rav and says, do we have a heter to use a condom to procure the sample for IUI, IVF, whatever it is, if the Rav is going to give a heter, it's also important for the Rav to remind them that the type of condom that they should be using is the one that the lab gives them, or the one that PUA provides, a special medical condom called the male factor pack. It is not a regular condom that is bought in the stores. Those are laced with spermicide, and if they were to try to procure a sample in that, by the time they bring the sample to the lab, the sample will be dead because the spermicide on the condom will have killed all the sperm. When I was in Eretz Yisrael, the first time I was there as working for PUA, so I went to Bikur Cholam Hospital, and I saw that many people delivering sperm samples to the labs, and I saw there were a number of samples that were actually brought in the regular condoms, and I saw the sample under the microscope, and everything was dead. All of the sperm was dead. So definitely Rabbanim should be aware of this and remind their couples that if they're giving them the heter to use the condom, it is a special medical condom which is obtained through the lab or through PUA, but not purchased at the local pharmacy. That's according to Rav Moshe, because biyadayim would be in Isser D'Oraisa. There's another method called a vaginal collection where the couple has normal tashmish, and then they either scoop the zera out or allow the zera to fall into a cup. That is what we call in Israel, they call the isuf vaginali. We call it the vaginal collection here. For that, some poskim say that should always be done. PUA's approach is for an initial semen analysis. That's usually okay, right? It's not much of a shayla lahalacha, and therefore for the initial semen analysis, that's fine. If the sample comes out good, in other words, the doctors run the numbers and it looks great, it's healthy, so then you can rest assured that that's a good sample, that's a healthy sample. If it comes back less than ideal, then it's the shape is no good, the morphology is no good, the motility is good, it's not good. Swimming, the mobility, it's poor sample. So it's not indicative of really anything other than the fact that it could be that the vaginal secretions and the juices and everything affected the sample, and they should try a second time with the condom. More often than not, once they do it with the condom, they'll see that the numbers are way better than the first time, and you have nothing to worry about. But we were able to do that without masturbating. Let's say that there is a real need for masturbation, whether it's because the condom doesn't work, because there's significant male factor, and we're afraid that the quality of the sperm is so poor that by the time they procure it in this fashion, whether it's the vaginal collection or whether it's with the condom, by the time it gets to the lab, it's going to be so poor and it'll be rendered unusable. Or it's cases like the woman's in nida, a woman's in nida, and they can't be together. So under those circumstances, we have matirim to be motzi zer b'yadayim. The Tzitz Eliezer was matir, Tzitz Eliezer and Chilek Tesim and Nun Aleph, as well as the Achiezer of Chaim Ozer was also matir. Fascinating case. I got a shayla not too long ago from a Chabad rabbi, and he was helping a couple who was not yet religious. So the way the rabbi said it was, they're not yet mikveh goers. So this woman is perpetually in nida. So you have to be very careful if we're talking about a couple who's less religious and they're not up to date with all of the chumras and all of the dinim of taharas and mishpacha. The woman is not a mikveh goer. That means that she's a nida. So anytime the Rav tells them to be together, the Rav is telling the husband to be boil and nida. It's a serious consideration. So either you work your magic and try to get her to go to mikveh, or if you don't have enough time or whatever, and you don't want to cancel the cycle, they're going to do it anyway. So under these circumstances, we'll go with the heter. It's not that we're going to be allowing them to do an isser. On the contrary, we're allowing them to be somech on the Tzitz Eliezer, somech on the Achiezer. And I know that Reb David Cohen paskins like this lahalacha, that for the sake of fertility, they are allowed to be motzi zer b'yadayim. Again, we don't encourage it, but sometimes it is necessary. Supervision is very important. Halachic supervision is very important when we're doing any treatment, and I can send you a list of all the various treatments, but anytime there's genetic material which is being removed from the body, whether it's the husband giving the zera, whether it's the eggs being extracted, whether it's even the doctors checking mid-cycle to see how the eggs are developing, how the embryos are developing, putting the embryo back into the woman, it's critical that there be hashgacha. The poskim wrote about this many years ago. This is Eliezer in Chelik Tes. He writes how there needs to be pikuach. The Lubavitch Rav Avadia writes that there needs to be hashgacha when it comes to these treatments. The Lubavitch Rebbe also in a letter wrote that these treatments should be done with hashgacha, and you could argue whether these sources would apply to Zman Hazeh all these years later, where the labs are better, the protocols are in place, there's more of a mirsas, there's more of a, generally back then, the doctors did whatever they want. There was no real, no one looking over their shoulders to see what was going to happen. And now it's very different. However, you can see even in recent years, no year goes by where a big story hits the paper with, some type of IVF mix-up, whether it's the New York Times, Chicago Tribune, The Guardian. Okay, in 2019, in an LA lab, there was a huge lawsuit because there was a mix-up where a Chinese couple, instead of giving birth to their Chinese twins, they gave birth to black twins. Okay, and there was clearly a mix-up in the lab. And just a few months ago, this article is from November 9th, 2021, from a lab here in LA. A Jewish doctor, an Israeli doctor who I've worked with, I've met with him, I know him, I've referred patients there. He's a good guy, but things happen and mix-ups take place. And I cannot tell you how many phone calls I got from women who either had children or are currently pregnant from his lab that I referred them to however many months ago. And now they read this story in the news that their doctor was responsible for, that lab was responsible for the mix-up. They're going insane. So we assured them that you had supervision, everything is fine, nothing got mixed up. The case is that there's never been a case of a mix-up with supervision. That has never, ever, ever happened. And in Eretz Yisrael, they have a list, in America, worldwide, of more than 50 mistakes that have been caught because of supervision. And there's so many more. Unfortunately, there's so many more. So it is important.
I wanted to see, just ask Larav, during COVID times, I've heard from couples that there are labs that don't let the halachic supervision in, due to, whatever wave of COVID was happening. And a couple would ask, do we still do it? Do we have to wait? What, to what degree is it absolutely required?
Even in Pua, there might be a machlokes amongst the various rabbanim of Pua, but for the most part, there are many rabbanim. We have to acknowledge the fact that there are many rabbanim chashuvim, poskim chashuvim, who hold that supervision is very important. It's extremely, we'll just say important, but it's not necessarily ma'akiv. We wouldn't necessarily tell a couple not to go ahead with the treatment because there's no supervision. Some rabbanim will tell you different tricks to tell the doctor that I'm going to do a DNA test, and that kind of gives them a little bit of a mirsas, afraid that, that gives them a little bit of a fear that they can't mess anything up. Whether or not that really does anything is questionable. Sometimes they allow the husbands to serve as a supervisor, which typically they don't. But in this case, if we're able to speak to the lab, and at least we'll make an exception that the husband could do something. Maybe that's better than nothing. But in the end of the day, we also have to recognize, although there are many poskim that say that it's absolutely necessary, Bizman Hazeh, with all of the protocols in place, at least as a b'diavad and a shasad chak, I feel like it's okay to tell people to do it. Also, we have to remember the thousands of people that have done treatment without supervision. We have to be sensitive to those people. We don't want them to feel that their children are illegitimate. We have to feel that their children are not really their children or suffix children. No, absolutely not. Absolutely not. And we have to be very sensitive when we speak about the importance of supervision. There are many people that they didn't know that their children, that for their first children, they had to have supervision, and now they do. So is this children more my child than the next? people can't, people get very emotional about it, and we have to be very sensitive to the fact that that emotion is real. Nevertheless, it is important for Rabbanim to encourage their couples to use PUA supervision, because we have seen, unfortunately, we have seen mix-ups, and it is scary, and it's catastrophic, and it's just it's horrible. Remote video camera is a possibility. Originally, the poskim assumed that would not be sufficient. Sometimes we have to, in a situation, we had, I think, recently a case in Florida where there was where they wouldn't let anyone in, but they would allow FaceTime. So listen, certainly not as an ideal, but if the only option is nothing else, so the FaceTime has got to be better than nothing. So we wouldn't allow that as a lechatchila option, but as a b'diavad option, as a backup option when there is no other modes of supervision available. So then, yeah, our policy has always been not to allow video cameras, but the makom that there's no other way to do it, so it's better than nothing.
The supervisors would use video cameras?
No. That meaning the embryologists. If there was the lab in Florida, I don't think it actually transpired, because I think they left the lab to do it elsewhere, but they wouldn't allow anyone in the lab. What they did was they said that they'll have someone from their team, from the embryology team, hold up a phone, and we would have a mashgicha on the other end of the, sitting here watching the thing, and they would literally kind of watch every step of the way, and they agreed to have one of their staff members who's in the lab hold the phone and follow the process so we could see, and then they would, I don't know, maybe we would say, I don't think it ended up happening, because I think the couple left the lab. They were too uncomfortable about it, but we discussed it internally if it would come to that, and we decided that it's better than nothing. Although it's not good, it's better than nothing. Very often, couples ask this following shaila: what happens? The labs give them paperwork that they have to fill out, and the question is, what happens in the event of a divorce or a death? What happens to these embryos? Do we give it to the party who's alive? Do we give it to no one? Are we allowed to use it for research? Should we discard it? Right? These are the shilas: discarding it or research. PUA's policy in general is to discard. There is no shaila, there's no halachic issue of discarding an embryo. It does not have the status of life, right? It is not considered a nefesh. It's not considered pikuach nefesh. You're not allowed to be machal Shabbos over it. And therefore, there's no problem of an abortion or a termination whatsoever. Better to destroy the embryo in the event of a death or a separation between the couple, and not to donate it to research, and do not award it to another member of the family at all. Just get rid of it. You will alleviate many, many issues and a lot of stress and serious shilas if these embryos are floating around, and certainly if they stayed in the hands of one of the family members. So just better to discard it and forget about it. Although I always remind people that once you discard it, that means it's no longer there. So if you worked very hard on creating these embryos, be extra careful before you decide to discard it, because once you discard it, you're not getting it back. So just, it's a simple reminder, and I'm sure they've thought about it a million times, but make sure that they don't do it, and they don't make a decision because they feel, sometimes you get the shaila, we've had these embryos for a few years, we don't want to pay the storage fee. So because they're in some type of financial crisis, they don't want to continue paying the storage fee. They throw out an embryo, which in a few years they would have used and they would have loved to use, but now they can't because it's gone. So just to make sure that they're really thinking clearly, and they're never ever going to use this embryo whatsoever. There is a shaila that comes up very often if a woman has to be inseminated while she's in nida, or if the egg retrieval is going to take place while she's in nida. So is that called a ben nida? We know that Chazal discuss a ben nida and say that he has certain negative midos. So is that a problem of ben nida? So generally the poskim assume not. Generally the poskim assume not, based on that taz, that the woman, if she conceives through something which is not derech tashmish. Rav Moshe has a famous tshuva where he writes that where the woman who called it, who wrote to him saying she's a balas tshuva and she's about to start shidduchim and she wants to know whether she's a bas nida, and Rav Moshe writes no because you have good midos, so it's muchach, the fact that you have good midos. So we don't have to worry about ben nida. That's usually not a consideration, although Rav Vosner is not too fond about it. Rav Vosner holds that really tipulim kodem tvila is a problem. He thinks it's a problem of ben nida. Rav Vosner, I think he quotes from Maharsham. He says, therefore, you should not to do it. A person should be very careful not to do treatment before the woman goes to the mikvah. However, we have a number of sources that do say that a woman is allowed to do, certainly if it's necessary, to do treatment, let's say an IUI. She's still in nida. Are we allowed to do an IUI? Rav Shlomo Zalman seems to matter, Minchas Yitzchak seems to matter, as well as Rav Avadia allows the woman to do an IVF, an IUI cycle before she goes to the mikvah. It is not a problem of ben nida. It's not a problem of the woman conceiving while she's in nida, but a major consideration is that of the sperm. If she's in nida, again, how is he going to procure the sperm? They're not going to be able to have tashmish together. So always in that situation, we recommend if you see that she has short cycles and you anticipate that the IUI is going to take place before she's going to kind of come back from the mikvah, always a good idea to freeze the sperm in advance at the lab, and therefore you'll have the sperm on tap. It could be thawed and used for the insemination, and he wouldn't need to procure a fresh sample that morning. Here's the sources that I just quoted: Rishevet Alevi and the Marsham, who disagree and say that the tipulim should not take place. Ramoshe matters it mefurish. Okay, so I quoted in the previous slide Rav Shlomo Zalman, Minchas Yitzchak, and Rav Avadia, and here Rav Moshe writes mefurish. He writes that it's mutter lezalif zera habal toch bitna alei dishvaferes ein tzarach letvila b'zeh. She doesn't need to go to the mikvah beforehand. It's not a problem. Ein shum pigia al havlad, and he writes therefore it's only a function of bias isser and not a function of the zera entering the body. So Rav Moshe mefurish permits it. Again, we don't recommend it as a lechatchila, but if this is the situation, then certainly one has what to rely on. Similarly, when there's no bia and it's just the zera coming into the woman, so we can discuss even mamzerus. I don't remember if it's come up in the past, but Rav Moshe has this fascinating tshuva that mamzerus is also a function of the bia. So therefore, if there's no ma'aseh bia, therefore there would be no mamzerus. If an ashes ish, if a married woman is inseminated with another man, Jewish man's zera, so we wouldn't say that that woman is now that child is now a mamzer because she got pregnant from another man's zera, because the only time we can generate mamzeros is through a ma'aseh bia. Here there's no ma'aseh bia, it's only the insemination, and therefore would not create mamzeros. Maybe even two mamzerim getting married and producing children through IVF. So maybe then those children, even though it's a mamzer married to mamzeris, the children wouldn't even be mamzerim at all. A way to eradicate mamzeris from the world, assuming that people don't practice nus. So as long as there's no nus, and everything, all the mamzerim are just mamzerim here and now. So if they were to have children through IVF, so maybe that we could fix the mamzeris issue in the world. Similarly, going back to that tshuva, and we'll end here, that shaila of a father who is a goy, the daughter, is she allowed to marry a kohen? So Rav Moshe writes that if the father was a goy through IVF, in other words, they took a sperm donor, the woman got pregnant from a non-Jewish sperm donor. So if that was the case, this woman, the baby who was born, the woman is allowed to marry a kohen is allowed to marry her. Why? Because the father, it's true that he was a goy, but there was no bia zisser. There was no bia between the mother and a goy. Even though it was his zera, but if there was no bia and it was only the zera, so Rav Moshe writes that would be permissible. That's explicit in the tshuva. I'm not sure why it was not on my slides, but I can send that to the chat. Mitzvah Shem, I will send that. Okay. I apologize for going 2 minutes over time. If anyone has any questions, please feel free. And anyone has to leave, also please feel free. And I will share the recording shortly. Be'ezras Hashem. Yashakayach, Kol Tuv Raboisai.
Thank you.
Thank you. Fantastic.
Thank you.
Amazing.
Hatzlocha Rabba.